so many different aspects of our operations, which was something that we were not doing before. So in there, because of the shocks and how quickly this landscape is evolving, we are exposed to some uncoordinated integration arrangements that we need to be able to, streamline to ensure that we are operating better. With the fund cuts are exposing us to inadequate supply chain financing arrangements to ensure that we're able to continue delivering optimally. Then visibility across the entire supply chain, I just talked about the need to streamline that. Most of the commodities that require ambient temperature monitoring mechanisms or storage, we need to ensure that we are able to monitor all that across the entire supply chain from the time we receive commodities in country, store them at the national medical stores, transport them to the districts, to the final service delivery points. And then absence of real-time data. Visibility is still a challenge, even for aspects that relate to our reverse logistics arrangements across the entire value chain. And then we are still seriously grappling with mechanisms to effectively streamline healthcare waste management arrangements across the entire supply chain. Next.
Jimmy, sorry, let me just come in again, just very briefly. Three of those challenges, if you could go back one slide, please. Three of the challenges you highlighted are linked to data. And again, it comes back to the skill sets that individuals will need. So again, recommending the participants who are almost 160 now, and there are more coming in, focus on data just as much. And also for healthcare waste management, there are short courses available. Some of them are free. We have some as well. Quick, easy wins as well. Waste management is, again, not fully and properly understood, especially pharmaceutical waste management. Next.
Thank you. So I just wanted to highlight some of the lessons we've learned because the integration has been ongoing for several years, but also as a learning supply chain, we've realized that it's very critical to ensure that collaboration is undertaken and that there's clear alignment in terms of what all the different supply chain players are doing. We saw this as one of the biggest challenges that could easily disrupt any supply chain. We saw it during the COVID vaccination, COVID outbreak response. An uncoordinated supply chain can actually be the most ineffective mechanism, even when you have all the resources that you need. So clear collaboration arrangements, clear coordination mechanisms, clear roles and budget without overlaps. This still relates to aspects of ensuring that there is effective alignment, ensuring that there's sustainability, sustainable investments in whatever kind of infrastructure that we are undertaking. And I will probably give an example, Prof. I think so many countries at the time when we had the COVID outbreak were quickly dashing to buy cold chain equipment and all that to store supplies. And right now, there are high chances that they have a lot of equipment that they're not able to use.
Right.
Yeah. And I remember we're grappling with that decision at the time until when we actually came up with proposals on whether we could actually acquire dual ULT equipment. So this equipment, the temperature ranges can be varied. So that means over and above using it for the time when we needed ultra low temperature cold chain storage capacities, we can now draw them down, and then we can still use them for other things other than making investments that are not, you've not really thought through it, and then you start having redundancies. Data reliability drives success. Prof, you had already highlighted this. We also just need to highlight that as one of the very critical things. And then moving, I think, to the very last slide. Next. Yeah. So what are some of the things, the areas that we are looking at to see how, if we could improving these mechanisms as a learning adaptive supply chain. And I just need to reemphasize this, that we realize that we cannot sit down and assume that we are there. I think there are instances where we've delivered and ticked all the boxes. I was having a discussion with our supply chain team, and maybe also to share this experience the during the COVID outbreak. Uganda was one of the only countries that did not stock out of any routine immunization vaccines. Now, the question is, how did that happen? Prof, you talked about data. I am highlighting aspects about the importance of supply markets analysis. It's because there was some data that enabled the supply chain actors to know that there are supply chain disruptions. So what mechanisms do we put in place to mitigate this risk? And I remember our team putting in place a resilience plan where we had to front load stock that could run us for a minimum of 6 months, even before Uganda locked down. NMS had pulled stock that could support the country run for at least 6 months without any resupply. And that was the magic. But how do we get that information? You're either monitoring your supply market, you have teams that are collecting the right data and are using that data to make decisions.
Right.
Progressively building capacity, having the right distribution mechanisms, and having the right digital tools and funding mechanisms, and then continuously improving. So that was actually the main message, because we have to be very honest about some of these things, Prof. We went through that phase several years after we had that success. We were actually being faced by the challenges that we probably thought our supply chain had, outgrown or had gone through. So then that now inculcates the need for continuous improvement and making this a learning and adaptive supply chain to progressively improve. Thank you. Over to you, Prof.
Excellent. Jimmy, that really sets the stage very nicely, both from your background and also from the work that the ministry is doing, focused on policy and strategy, and setting the stage very nicely also then for Dr. Paul Okware to come in and talk specifically about the journey. I first saw NMS almost 20 years ago, and then I was there much more recently. And I've interacted with Dr. Paul Okware in several leadership forums where we've discussed strategy of other central medical stores and what learnings NMS has brought for themselves. So with that, let me read out some of the special points about Paul: Senior Public Health Supply Chain Executive and Chief Stores and Operations Officer at Uganda's NMS. And if you read those words, an executive, operations officer, chief operations officer, this is for the rest of the participants. This is where you want to be in the future. You want to be the future Paul Okware. Well, of course, he'll be higher up by then. So do reach out to him. Over 2 decades of experience, he has built deep expertise in. What's interesting here, we were discussing, is pharmaceutical manufacturing, GDP compliance. So he's coming from a completely different side. Public procurement, ERP-enabled supply chain systems, all the data discussions, and I even read in the chat individuals talking about ERP. So manufacturing, ERP, supply chain, and now leadership. Works closely with Ministry of Health, Gavi, and the development partners in strengthening resilient supply chains. And I've also asked him to talk about workforce and what kinds of team, people, skill sets that he's looking for when he hires people as well. Paul, I give you the floor. Thank you.
Okay, thank you very much, Prof, and a very good morning to everybody who's taken the time to join in on this webinar. It's quite a pleasure for us to engage once again and share things supply chain related. It's always exciting for some of us to actually find like-minded people who are interested in this very narrow field that sometimes does not get as much of the limelight, but keeps the lights on in many of these places. It's a pleasure to be here and to present. For those who may not know me, I am Paul Okwari. I am the Chief Stores and Operations Officer at National Medical Stores. I have been for more than 10 years now, since 2014. And surprisingly, as I was preparing for this webinar, I realized I have been a pharmacist for 20 years this year, which is quite incredible. I always thought myself to be one of the younger people in this area, but time does fly, especially when you're in supply chain. There's always a challenge that is always just right outside the door. Maybe a quick brief on my journey to how I got here. I did study pharmacy as my undergrad, and I think at the time my passion and excitement was always around manufacturing of health commodities. I did as much of my internship in factories when I had the chance, and I always felt that is a space I would work in. So operations has always been an area where I felt I could lend myself, being interested in always the data that moves the needle a little bit further, and seeing how we could drive efficiencies, at least in the local setting, like a factory where you control many of the parameters. But as my career progressed, I got into distribution for a major multinational pharmaceutical, distributing commodities across Uganda. And that's where I think I started broadening my appreciation for the landscape within which supply chain can apply and influence people's lives across the country. I worked in the private sector trying to make sure we could have an efficient distribution mechanism within the private sector. And then I joined National Medical Stores in the current position that I am in. Previously, it was called Head of Stores and Operations, but the position was changed a little later to Chief Stores and Operations Officer. So the skill set I think one needs for this role here again is a very keen detail, for numbers, operational numbers, whether it be in a factory or an operation. The small numbers always make up the big ones. So you've got to have a very keen eye for what exactly is required for you to be able to deliver. You can tell from my colleagues' background, we're slightly different. Some of us are coming more from the shop floor, from the factory floor, from making sure we can get the boxes on the trucks and delivered. Jimmy's posture is a little bit more on the side of having the right policies in place. I think maybe for this, I think I'll share a presentation
Paul,
I have prepared.
Paul, sorry, just before you jump in, let me connect the dots for the participants again. So interestingly, my background is a blend of yours. I started off in pharmacy, and my first job, in fact, was when generic pharmaceuticals in the United States were just being introduced. And we're talking about mid-1980s. Okay. I just finished my pharmacy program, and this was the time when big pharma were teaming up with generics, and a lot of generic industries were starting out. That's how my career started, from, again, manufacturing, which ended up in hospital clinical pharmacy, and eventually working with organizations, implementing partners, WHO and the Global Fund. So bringing in Jimmy's policy side and strategy side at the global level through WHO, and the financing side from Global Fund. So again, for the participants, the journey that you take, again, that might seem a little less connected, but everything that I've done was under the focus of access to medicines. Access to medicines from manufacturing, access to medicines from clinical delivery, access to medicines in terms of setting up procurement supply chain systems in, 20, 30 countries. Same thing, financing side of access to systems and the policy side of access to medicines. So it was always that. So and it's all about storytelling. Again, I mentioned this to the speakers, but also to the participants. When you're communicating, first you must have your own story that should be clear. Where you are today, how did you reach there? and where you're planning to be in the future. It may not be clear, but find a way to connect the dots. And when you stop and you look back, you'll see that there is a very strong thread and footsteps that you've actually traveled. So, Paul, thank you for that introduction. I'm glad to see that there's commonalities, and I give you the floor back for your presentation. Thank you.
All right.
Evolution,
Okay.
NMS, and how you got here and what your plans are for the future.
Okay, very good. You know, surprisingly, most of the people you meet in supply chain actually did not start their careers hoping to get into supply chain. People kind of stumble
Indeed.
here. But again, when you have purpose, like you were saying, Prof, you will find you will stumble your way here. As long as you're looking at
Absolutely.
providing mechanisms for people to get drugs efficiently and they're of quality, somehow you find yourself at the same table with like-minded people at the end of the day.
Indeed.
Yeah. So I hope everybody can see this. I'll just be sharing very quickly. So I'll be starting with an overview of national medical stores, basically what we are, what we do, and what has made us succeed. And sometimes I think some people will be hearing me mention the most obvious of things, but sometimes they're the most fundamental. National medical stores are set up by an act of parliament in 1993. That makes us more than 30 years old with key responsibilities in procurement, storage, and distribution of essential medicines and medical supplies to health facilities in the country, basically government health facilities. Many other national medical stores I have seen basically have the same act that brings them into existence. But to actually find it being lived in the country many times is a very difficult thing to find. There is always a push and pull either between other agencies, they may be private, or even it may be the Ministry of Health, trying to do portions of these supply chain aspects, and it creates a bit of tension all the time. I think one of the things that has allowed us in Uganda to succeed very well, especially with the vaccine program, is a clear understanding of the mandate of national medical stores and the responsibilities of the Ministry of Health. We are responsible here for the procurement, storage, and distribution of essential medicines, and this will include vaccines. And my colleague, Jimmy, on that side from the Ministry of Health, have also very well understood their responsibility in making sure that they are setting in place policies that can actually work and can be implemented in the country. They are responsible for setting standards, which we also have to comply with as the medical store. So they hold us accountable. And they're also responsible for resource mobilization. Those are the three that come to my mind. If the Ministry of Health does those well, then NMS can do these three well. Then you have a system that can work and can complement each other. You find that from time to time, if we are slacking behind on some KPIs, they are there to make sure that they can hold us accountable to it. But then again, if resources are lacking or we feel the policies being implemented will not generate the results that we envisage at the end of the day or are impractical for some reason, then we can also advise on how that can be amended. But the thing is here, we have a very clear understanding of the role responsibility and the role matrix within the country. Without this, you definitely will end up with a very, very big problem. And for example, in Uganda and with vaccines, we've gotten to a point where national medical stores handles the logistics of vaccination, which is very rare in most countries. And Jimmy shared that, and it's one of the reasons we have succeeded. But to get to this point, I do recall even one minister lost her job just to try and make sure that this was actually implemented. Very painful decisions to make sometimes, but again, the leadership has always been steadfast from the ministry to try and make sure that policy, resource mobilization, and standards are clearly the mandate of the ministry, but the operational decisions that have to be made on a day-to-day basis are made by the National Medical Store. A very important thing also to appreciate here is that while they are autonomous, there's a degree of flexibility that is required for a central medical store or any supply chain entity to function well enough. And I think that is why those who came up with this act tried to make sure there was some degree of independence same degree of flexibility, so that you could take up innovation when you see it necessary, but also try and work as efficiently as you can. So the way the act that brings the entity into being was crafted is very important. The leadership to make sure it is actually lived is even just as important. And then for those in those entities to actually believe and make sure that it works is also been very, very key in our journey. And that is something we do appreciate. All the discussions we're having here would never happen if the ministry tried to do the work that we do, or we try to do the resource mobilization that they do, or try to set the standards. This is very fundamental for us to appreciate how health systems should be organized and be led. Very, very important for this to happen. The key interventions in the transformation that we have had as a central medical store, I will share these so that people can understand the key things that we have done to make NMS NMS. They may seem simple in some people's eyes, but as a country, we have seen these to be fundamental in trying to establish a system that can work for us, a system that is easy to understand by all stakeholders, which is a very key thing. We don't want to develop the most complex healthcare system or supply chain system. Yes, it may be good on paper, but we want something simple that people can understand and plug into, so that even as other programs come along later in the country, we have something that people can easily articulate and take advantage of. So one of the first interventions that we had as a country was in the area of procurement. As I had shared, we are national medical stores, but many times you will find this is actually not being lived. There's a country we were just discussing yesterday, Prof, where you have a central medical store, but they do not have the funds for procurement of medicines which are going to be consumed nationally, and that undermines the purpose of having that entity. So for us in 2009, the government took a very important decision to centralize all the funds that were available for the procurement of essential medicines under the Ministry of Health and local government. This also expanded to the army and to the police later in 2011. But the key reasoning here was that previously the Parliament of Uganda was voting money to different districts, different health facilities for the procurement of essential medicines. And you can imagine we have more than 3,400 of these across the country, creating almost 3,000 accounting points. It made accountability very difficult, and even the quality of service was varied across the country. By making sure that this money was channeled through national medical stores, we were able to have a single point of accountability. So implementation of policy was much easier. We could also take advantage of economies of scale, and now government could actually start demanding for value for money. So right now, if you walked across any health facility in Uganda and looked at the invoices that have been given to them along with the commodities NMS has delivered, and compared if you could get that price better outside in a private pharmacy, you will find definitely that the prices we are offering for every single item are much better than those you would get in a private market. And that is very important for us. We are audited every year by the Office of the Auditor General, and value for money is one of the key things that is being looked at. When you pool money for all the health facilities in the country, you do get a lot of leeway in terms of the pricing you can be able to get from manufacturers and distributors in the country. And that has been a key argument for us from the very start. So we always check every year to make sure that we can offer best value to our clients, where they feel that maybe even we would get a better price. We're always open to that, and we always want to have an opportunity to engage with them and maintain that position. Importantly, before this money was centralized to national medical stores, our service fee, or the handling fee, which is the cost it would take us to warehouse and distribute these commodities, was about 35% of the total value of the commodities. So if we delivered to a health facility commodities worth, say, $100, we would charge, or it would cost us an extra 35 to have those commodities delivered, because we basically had to borrow money from the banks to finance the procurement of these items, pay salaries, and ultimately have them delivered. But when we centralized the funding, now it is costing us between 6 and 10 Right now, we know the highest to be about 7% for the different program items of the value. So basically, for every $100, now it's only costing us at maximum about $7 to have that delivered just by pre-financing us and making sure that this can happen. So what essentially this means is that for the same amount of money, facilities are getting almost 20% more in terms of purchasing power, which translates into a lot more commodities for them without an increase in budget, just shift in policy. It's also been able to improve availability of essential medicines. Before this was introduced, we were seeing availability for tracer items, even at the central medical store, as low as 21% because they're struggling to get sufficient funding to procure enough medicines. Right now, as we speak, at the end of quarter 3, which just ended in March, we had availability figures up at 91.9%, which is quite incredible for the entity. It also supports us in the way we do the procurement planning because the facilities basically have their money with us. We have to agree on a periodic basis the range of commodities that they will want and the quantities. So it makes forecasting much easier for us than to have items in stock and hope facilities will come and purchase them. So this has been a big game changer for us. It almost makes it makes it easier for us to have an idea for what they will want. The onus is on us to try and see if we can interest as many people from the private sector to come in and participate in these tenders and give us good prices once the quality has been confirmed. This is a
Paul, if I
major
could
step
just,
for us.
if I could just come in there, you mentioned a couple of key points, which connects with something I said right at the beginning, which is what is a country's GDP expenditure in logistics? It shows the efficiency of how they are managing logistics, how they understand the whole supply chain system. The higher it is, the less efficient they are. And what you've done here, what you're showing is the same thing happened with NMS. You went from 35% markup handling fee for storage distribution down to 6 to 10%, which is sort of the rule of thumb in terms of highly efficient developed countries, what they're able to achieve. There's a fantastic World Bank report that actually shows you the logistics costs of a country linked with the GDP. And it'll be good to compare where you are relative to where Uganda is overall as a country and where NMS is from a pharmaceuticals and healthcare point of view. And also the fact that you have 92% availability is fantastic. It's extremely high. And in some countries, what they've done, in some of the states, for example, in India, they have the public sector has opened retail pharmacies because this is all for public, usually for clinics, for hospitals. But because they have such a wide range of products, low cost, good quality, in some states, they opened retail pharmacy for any patient to walk in and get access to these products. Because what you're doing is a public good, and that really expanded access and has created huge impact. So something for NMS to also consider as you expand and grow. Over, back to you.
Yeah, Prof, that's a very good point. I think currently I'm actually giving this webinar from Tanzania in Dar es Salaam, and I think they have something very similar here as well, where they're trying to make sure that they can leverage on government's purchasing power to extend that even to the ordinary people who may want to purchase these things. I think in Uganda, the position may be slightly different. I think the decisions have not yet been made. But I think there is more a push for national health insurance to see if we can have that offered and engage the private sector even more to offer this. But we've not yet been able to reach a decision there politically on how we can engage private sector, especially on national health insurance. And hopefully when that comes through, I think we will see something slightly different from us. But I think that is a very good opportunity as well. I mean, if there are efficiencies within a country, it shouldn't matter who's offering the service as long as it's of quality and people can benefit from it. I think ultimately that's what we want to see at the end of the day. So the other area, simple things that we did in the country, I realized from the vote that we did much earlier. A lot of the people seem to be supply chain people. And I think we all share the same problems in different countries, especially in low-income countries like ours in Uganda. We all struggle with issues of pilferage. Government is committing large sums of money to get into the public sector. And if there are deficiencies within the private, naturally there will be it will move almost by osmosis that side there. You end up with commodities moving across areas where they are meant to be offered for free, and then them pilfering into the private market and even crossing borders. So embossment was another key thing for us because now we had sufficient funding on the government side. We now started requiring our suppliers to mark everything that we are purchasing using Government of Uganda financing very clearly, saying Government of Uganda not for sale. This made it very easy for us to identify commodities which are meant to be given for free and had been taken out of the supply chain, and people were trying to either make money off of it. Also, just to empower the citizens to make sure that if they see commodities which are marked Government of Uganda, they should know they've already paid for those commodities through their taxes. They should not pay again. So it made it difficult for those who were trying to benefit from creating artificial shortages, claiming medicines are not available, and then trying to pass on or sell commodities which have already been paid for. These seem like simple things, but in contexts like in Uganda, it's very, very important and powerful. That meant that you had ways of making sure you could easily identify people who are taking commodities out of the public supply chain, but also making sure there is visibility for government's effort in trying to make sure that medicines are available. And also, you could be very sure that there is an understanding that this has gone through government's quality systems and is a quality product. So it gave a lot of visibility for government's effort in making medicines available, but also stopping a very bad habit, I think, which we've seen in many countries where commodities which are meant for free are actually being taken and sold elsewhere, which is very important. Order management is another very important thing. It is not very easy to have quantification done for a whole country. In Uganda, we've got more than 3,000 health facilities, closer to 3,500 now. Getting all of them to be on the same page in terms of the range of commodities which are going to be ordered, the cadence with which they're going to be ordering them, and how much variation we can accept in what you had planned and what you actually intend to receive is something we had to grapple with at the start. Not very easy. And with supply chain, sometimes you find the quality of the deliveries we make are informed very much by the quality of the orders and the information that we get from the health facilities. So trying to improve facility data to make sure that we have informed stocking of commodities at the main warehouse and also what we deliver was very important for us. So to start this off, we implemented what we call a basic kit with the Ministry of Health. We had to agree on the range of commodities we would offer for especially lower level facilities, which are quite numerous in number. We had to make sure that we would appreciate the basic health care needs for Health Center 2 and 3, agree on the formulations we'll make available, and also agree with them on the range of commodities that we shall be providing on a regular basis. So we also, on top of this, came up with what we call a delivery schedule, basically a cadence with which we would be delivering commodities to every health facility across the country, which we came down to about 2 months, which was very important for us. So we deliver commodities for 2 months. You get a month to use them, and then you order based on that, and then you can get stock again for us. That's been very important and should not be overlooked because every program that came into the country after this basically piggybacked on that delivery schedule and reporting mechanism that we had established through this order management system that we were able to establish. So if somebody came into Uganda willing to support a different disease area, they very quickly would get to know that, oh, these facilities receive supplies on a bi-monthly basis, and there's a sequence for reporting, there is a sequence for receiving and consumption. So everybody basically gets to understand how the system is working. And that's why I spoke earlier a lot about trying to make sure the system is understandable for everybody to appreciate. So the basic kit for the lower level facilities, this was very important because we used to struggle in trying to get properly articulated orders for lower level facilities because of the skill set that was lacking at those levels. So the kit has worked for lower level facilities, but we're always experimenting to see if there are facilities that develop the competence to make orders. We are allowing those ones to make them. But where they do not, we're working with the basic kit just to cover the basics. And again, we're sharing again how we have progressively improved in availability, and we're all hovering above the 90% mark, which we think is still quite very good for us. Another key intervention for us was last mile delivery. We had a model in our country prior to 2010 where we basically used to have a stratified supply chain. So you have the national level, which everybody appreciates, and then we would take commodities and give them to the sub-national, which would basically be at the districts, and then expect that sub-national mechanisms to have distribution from the district stores down to the health facilities. So you basically have at the national level where you have NMS, you have MOH who are doing the resource mobilization. We would procure the commodities, have them in stock, give them to the districts, and expect that at their level they would now have commodities sent down to the individual health facilities. And we found this to be very problematic. Not all districts had the resources, the knowledge, the willingness, and even the terrain in many of them was very difficult for them to have these commodities distributed on time. And they really did struggle a lot. And so what we did was something which at the time, because you see we did this in 2011, which was slightly against the grain, is that we took responsibility from the central medical store to make sure we were responsible for carrying commodities up to the individual health facilities. Now, at the time, we got in trouble with so many people trying to do this because the textbook definition of for how supply chains work is that at the national level, you do what national or central medical stores do, and then you allow for the sub-national systems to also do their bit, and then the facility levels to do their bit. So we basically took responsibility to take commodities all the way from the center down to the health facilities. The key things here, it had not been done. I remember many of the development partners we even work with today were very, very angry with us that we were even thinking of making a decision like this. The second thing making it even more difficult is that we did not have the resources. You can imagine we had just reduced our service fee down from 35. I remember at the time when we had come down to 8% for the essential medicines. And now from that 8%, we were looking to be efficient enough to save sufficient money to now move commodities from the district down to the individual health facilities, which is always more expensive. Moving commodities, say from a manufacturer to a central medical store, is not as expensive as moving it from the central medical store to the district, and it is always more expensive, actually exponentially expensive, to move it from the district level or subnational level down to the individual health facilities. So we had to find ways of doing this as efficiently as we could, but also without requesting government for additional resources. And also we had to deal with the backlash of people saying, this is not how you do it, go and benchmark. But I think some of these things we have done here have been slightly against the grain, and people have only found us to be right at the end. But again, we've been willing to try and fail, not to try at all. And this is one of those things there that have significantly changed the way we work. And now we have many countries coming to benchmark and try and learn how NMS was able to implement last mile delivery for vaccines. I don't remember a country doing this before we did. I think those which had better systems at the time had the different strata of the supply chain working well. But to find a central medical store going down to facility level, I think was a very rare thing. And we're pioneers in this area, and we made it work. And not just made it work, but made it work within the very tiny budgets that we had at the time. So we started finding massive improvements in availability of these commodities at health facilities.
And Paul, just to mention, last mile delivery is really the acid test, the ultimate test of a capability of any medical stores or any supply chain system. Anyone can deliver in an urban environment. They can deliver in peri-urban environment, but last mile delivery have the visibility and do it in a crisis setting. Now, now you've checked the boxes and you can take care of your population, and it's something that the other countries would also appreciate. And Paul, if I could just ask you to accelerate or focus on the last couple of key slides so that because we only blocked out an hour for the colleagues, and I know they've been very patient and they've stayed with us. We have actually even more people now, but let's try and bring this to closure, but make sure we have your key messages. Back to you.
All right, brilliant. So I think the key ones I think I have covered. I think I wanted to spend a bit more time on these here because from the people available, I thought that this would be of interest to them. But those are the key things we have done. The other areas is more of engagement with getting closer to the clients. We've set up regional offices. Again, this just improves our interface with them, understanding and appreciating their needs, I think, which has been very good. Another key one, which we worked on very, very hard with the Ministry of Health, is transferring procurement and handling of vaccines. This happened in 2012. Again, this was a big one for us. Again, everybody say this is not how it's done, but we were very brave, again, along with our ministry, and we went ahead with this. And the procurement, handling, and distribution of vaccines was given to national medical stores, and it's been a wonderful success ever since. We can see from the graphs here, prior to 2012, we had our coverage hovering about 78%, and basically it was not getting any better from them. But once the ministry took over the policy issues and we handled the supply chain aspects, we are now hovering much closer to 98%. And when you use the DPT3 indicator for that, this has been very important for us. There are several other interventions, I think maybe which I shall share in the slides in what we have taken as building blocks to build NMS to where it is. This maybe we'll share with members just to appreciate a little bit later. Things like being ISO certified, very, very important. For perspective, we were the first MDA. MDAs are ministries and departments of government. We were the first MDA to be ISO certified in Uganda, showing our ambition much early on how we want to make sure we can implement quality systems across the country. We've also had a journey with immunization in the country. I think members will be able to appreciate this. But I think this is all culminated in our resilience. And I think this is what we always strive for at the end of the day. You will have all those systems in place, but they're always tested when you have a crisis. And I just wanted to speak to one of the most major crises that we had, I think the one Jimmy spoke about, which was the COVID outbreak that we had in the country. Throughout that outbreak, our mechanisms of last mile delivery were still able to hold out well enough. We did not disrupt distribution of essential medicines. We did not disrupt distribution of vaccine supplies. We did not disrupt even distribution of public health emergency response supplies. And we were one of the only countries that did not stock out of any of the critical supply vaccines, basically, throughout that period. And we were able to win this award here, which was the 2022 Global Health Supply Chain Summit Prize, basically for our resilience we showed, especially through the COVID outbreak, which was very important for us. There are other host of awards that we have been able to win, especially with the EVM. Even very recently, we had an in-country assessment where we scored a 95, which was quite impressive. I think those who are involved in EVMs in other countries will know what it takes to score a 95 at the central level for national medical stores. We're very excited about that. Maybe when I'm done with this presentation, those from other countries will tell us what they were able to score, but we're very proud of being able to demonstrate capacity, especially at the central level. Our focus, especially with the Ministry of Health and with Jimmy, is try and make sure that we can cascade this competence down to the lower level facilities. The aim is not to have capacity of competence at the national level only. We want to see this cascade to lower levels because that is the true measure of impact. If this can be felt lower down in the facilities. So I think just also to share where I think we want to be in the future, the key areas where we think development will be made in the country is in the field of electronic medical records. That is something that's very important for us. Digitizing that bit of facility level visibility is something that is very important to us. And we are hoping that with EMR is being deployed this year or next. We shall start getting better data on patient records, and which will allow us even do quantification a lot better. And currently, we're also working with Gavi and with the ministry on the implementation of an ELMIS for vaccines. These are very important. We believe data is very important. We cannot optimize past where we are right now without better data. So we're looking to implement electronic systems, and we believe these will be the things that will catalyze growth and catalyze improvements and optimization of our supply chain from here on. I think with that, I'll say thank you very much for paying attention. If there are questions, we'll be available. We would like to share more of our stories. And also, if there are lessons from the other countries, we're also very willing to listen and share. Thank you very much, Prof.
Excellent. Excellent. I was looking for the digital clapping of hands and thumbs up, but I don't seem to be able to find it. But anyway, I would have done that multiple times, listening to all the awards and seeing everything that you've achieved over a period of time. And again, kudos to NMS. I know it's a team of more than 200 people that have put this together. And also, again, that's what monitoring and evaluation does, which is you look at the baseline where you were 30 years ago and where you are today. And you're off to Tanzania, you're still learning over there what new things we can adopt and adapt, and vice versa, and share across East Africa and other countries how they can also pick up the best aspects of what you're doing. Wonderful. So I've already typed in the chat that for the participants to put in their questions that they would like the panelists to respond to. And if I could request Jimmy, Paul O, and others to take a look. Some are related, some are quite specific, that are directly requested for you to respond. In other case, they're more generic, and some are academic and capacity building and skill related. I'd ask the empowered team, the faculty members, Dr. Harpreet and Dr. Shamli, to respond to that as well. And what and if any of you want to speak to any particular question that's come up, by all means, do that as well. We'll do the Q&A for about 5 minutes. And the other question that people asked, will we get the presentation? The answer is absolutely yes. So requesting the UN team to make sure that you have everybody's slides and they're shared with everyone by email would be great. So
yes, Paul, thank you. Emails will go out in the coming days as soon as we have collected all the presentations. Thank you.
Perfect. So panelists, anything you'd like to respond to, please jump in.
Thank you, Prof. Jimmy here, and I know that during my presentation I did highlight our ambitions around creating a regional hub, and we've progressively been working with the colleagues at National Medical Stores, not to just build capacity, and this is in response to the question in there on whether there could be a supply chain hub in East Africa. I think the ambitions are well aligned to ensure that that happens. And we are working with several partners to ensure that, that these ambitions are translated into reality. And in retrospect, we're also working so hard to progressively build and strengthen capacity at National Medical Stores to ensure that we realize this ambition and that we're able to undertake those additional responsibilities that might come with us taking over that additional responsibility in terms of response to stockpiling for outbreaks, supporting our colleagues in the region in case there is need for any kind of interventions in relation to times when their supply chains are challenged. So these ambitions, we have these ambitions, and we are really working together with our colleagues to be able to move that to move our capacities into the next phase. Over to you, Paul.
Yeah. Actually, Paul, just give me a moment, and if you want to, any of you want to type more responses, could I just ask the team to share slides again? There's information I wanted to share with the participants related to potential jobs and careers, career growth that would be valuable for all of you. And again, this will be part of the slide deck that we'll be sharing. Okay. So you heard, and especially because most of you have less than 5 years experience, it's the time to grow and learn new areas. So you heard from both NMS and the Ministry of Health of Uganda, the areas that are needed, the areas that need growth. So even though you've got a situation where a lot of donors have disappeared, donors and implementing partners, and funding is reduced, with the right skill sets, there'll always be a need for you. Private sector is growing, GDP is growing. The continent is one of the fastest growing continents. And East Africa is definitely an engine for growth as well. So if you take a look from supply chain professionals, data analytics, data keeps coming up. Go to the next slide, please. So, and again, the youngest continent on the planet, it's a tremendous advantage. And the question is, how do you use this benefit? And what you're learning, I mean, during my time, if I had one career, one educational background, I was fine. In your time, every 5 years, you'll need to reinvent yourself. My children are 20 and 27 years old, and they know that they need multiple skill sets. So how do you, every 3 to 5 years, top it up with another skill that you're going to need and make yourself relevant, just because the environment is changing so rapidly? So you heard from Paul, how he transitioned, Paul Okware, how he transitioned from manufacturing to where he is today as an executive, and watch your own journey transforming as well as you move forward. Next. So what are some types of employment opportunities across Africa if you look at the career level, entry level, where majority of you are, mid-level and senior level, and the kinds of positions that are needed. And you can come from any background, whether it's pharmacy, management, regulatory, policy. So procurement officers, finance background is very common as well. Management background is common as well. So you've got procurement officers, supply chain assistants, etc. If you go to the mid-level, you're now talking more at the management level, and then you go into the leadership level. Procurement, supply chain, program and operational leadership. And again, look for those types of areas where you bring your best skill sets or develop those skill sets. Who are some of the key employers? And I would also add private sector to many of these as well within your own country. The different job platforms, subscribe to them, join these kinds of webinars, build that network so you get to meet other people and talk about yourself. We open the chat so that you can introduce yourself. There are people who are looking for employment, and there are people I've noticed who are looking for the right talent pool as well. So reach out, network, it's super important. Next. And for those, depending on your background and where you come from, we focus on, this is in partnership with the UN. And when you graduate, you get both an Empower and a UN certification, a Master's of Science in Global Health Procurement and Supply Chain. This one is specifically focused on global health, procurement and supply chain. So it's healthcare related. It's not generic supply chain. We're not talking about any other industry except global health, public health, pharmaceuticals, vaccines, devices, diagnostics. So by the time you're done, you really understand what are different kinds of health commodities and how to manage them. And there's a 2-year program. For those who've already done the postgraduate diploma, you can top it up with a 1-year Masters of Science as well. Next slide. Procurement and supply chain jointly developed with Chemonics, Village Reach, People That Deliver, and there were several other contributors. Check this out if you already have a supply chain background, a great top up for you to do so. The topics are of interest. And in fact, I think there are some of the co-faculty members that are actually attending this webinar as well. Next. We heard about pharmaceutical management. Now, the continent is really focused on pharmaceutical management and manufacturing. And here, this positions you to join both the public sector and the private sector. So if you have a pharmacy background, generally, this would be a great postgraduate diploma. If you have a health sciences background, chemistry, nursing, any biology, general health sciences, this would, again, be a great top-up. Next. And these are the ones that are upcoming. Masters of Science, in fact, they'll be launched in May, so next month, in a few weeks' time. Master of Science in Pharmaceutical Management with a specialization in manufacturing. And Master of Science in Pharmaceutical Manufacturing, that'll be launched a bit later. Next. Yep, we're on the Q&A. All right, Paul Okware, can I give you the floor for your last few words or responding to any questions? And then we have a poll that we'll close out with.
Yeah, I think I will go very quickly. I tried to run through the chat and I saw a couple of questions here. I'll just answer them. There was, I think, NASA from Tanzania asking if medicines are given out for free in Ugandan public health facilities. Yes, we offer them for free. Or, however, higher levels of care do offer grade A services where they can have paid for services as well. But generally, the grade B services in Uganda are offered for free. Someone from Zambia also said they already have an EMR working, and WMS, I would say congratulations to them as well. There was Emma also asking, they've done a degree in biology and environmental science. They're asking how to get into the profession. I think it would definitely be very important to get a qualification like Prof you have described. Some of the molecules that we handle are very peculiar, and we look for people with those particular skill sets in those areas, but it does give somebody a huge advantage if you have some understanding and qualification in supply chain. So like the diploma or master's degree, like Prof has just described, there would really, really be of value for you to appreciate and also widen your horizon for opportunities in the future. Definitely very important. Namibia, we had Solomon and Hannah also asking important things on forecasting, procurement, and data sources for quantification. I know this is always a very tricky thing. So what we've done in this area is that every single year we have what we call a procurement planning exercise or a quantification exercise or needs assessment. We visit every individual health facility and demand for morbidity data to look basically at the mobility patterns that they have. And from there, we deduce along with them what their needs for the future should look like. That is very important. Short of this, it is almost near impossible. So we basically spend a lot of money going to every single facility, going through their data and trying to come up with procurement plans or needs assessments that are tailored to that particular individual health facilities needs every year. And that gives us a very good basis to start from. So once we get data from there, we can procure and keep in stock with some degree of confidence. Before, when you just rely on them to come up with figures, it would be very risky. We used to suffer big expiries, but now we invest a lot in trying to make sure that data is correct. But now that we've learned how to do it the manual way with Excel sheets on paper, now we're looking to digitize that with the patient information systems, or the EMRs as we are calling it. But again, the data points are always from the facility. For other programs, maybe like with vaccination, maybe you'd use demographic data if you're looking for coverage, but most of the essential medicines, it is actually data from every individual health facility as long as you're going to benefit. It's worth the investment. Otherwise, you'll end up with a lot of waste. I think from the questions, Prof, that's all from me. Thanks.
That's excellent. Thank you so much. That's very fast and very effective coverage. Luca, I give you the floor now to bring it all together, tie it up with a nice poll. Over.
Thank you, Paul. Thank you all participants for being here today, and of course to our key speakers. We'll be ending with a quick poll, which I'll share in the chat now, which I hope you can see in the next coming seconds. Just give me a thumbs up in the chat if you can see it. Take a couple minutes to fill it out for us, please, so we can have a bit more understanding of how you thought the webinar went. And apart from that, I'll drop my personal email in the chat as well. So any inquiries, please feel free to contact the Empower team or myself. Thank you very much.
Luca, if you could show all the panelists, please. How's it looking, Luca? Are we nearly there?
Almost halfway there, but I think I'll go through the preliminary results right now. So great to see the feedback. Thank you very much for participating today. Great to see that we have a lot of improvements and positive feedback on today's webinar, with 62% thinking that they significantly improved their understanding of health and supply chain systems. So thank you for the key speakers for providing that knowledge to everybody. In terms of how the content was for the webinar, highly relevant with 85%. So great to hear that. Based on today's sessions, how important are strong public health supply chains for achieving universal health coverage? Great to see that everybody almost agrees on that, with 80% thinking extremely important and 12% thinking moderately important. Coming up to which actions you're most likely to pursue. 38% apply learnings to improve supply chain systems in my organization. 39% strengthen my knowledge and skills in supply chain management. and 14% exploring career opportunities in health supply chain, with 9% in sharing insights with colleagues and stakeholders. Great to hear. Thank you. And in that, overall, great feedback. Thank you very much for participating today. Panelists, if you have anything to add, or Paul, if you have anything else to add, please feel free to do that now. With that, I'll be ending my poll. And thank you very much for joining today.
That's wonderful. Let me come in by asking everyone, actually, I'm not sure they're able to turn on their video, but I think, Luca, you can. So what we'd like to do at the end is so that everybody sees everybody. And then we take a screenshot and share with them, and also in social media as we give you the moment to vote for your audio and video as well. So please share your screens. The future Paulo Quades and the future Jimmys. All right. And as we're doing that, just wanted to let you know that in August, we are Empower, and the UNITAR group is hosting in Geneva a youth in healthcare careers workshop for 5 days. For those who would like to attend, it's at the end of August. We'll be sharing those details with you as well. It's a 5-day workshop, August 17th to 21st. It'll be held in the UN building, in the UN Palais, and it's being formalized. So if that is of interest, please do reach out to us. Look, are you able to, because I can't see the participants. Do you know how that works?
Working on it currently. Give me
Okay.
1 second.
All right.
Actually, if you could give me a couple pointers, we're trying to figure this out with the comms team right now, but
Shamli, Harpreet,
Dr.
do you know how
Thakur,
they can give the permission for everyone to put their videos on? Yeah, participants, give us a moment. The UNITAR is just giving the necessary approval for you to do that. They're looking for the right button to press. Shamli, if Raman is there, you could ask him, he might know, but we've done this before, so it should be straightforward. There's always AI to help you. Okay. Well, if not, it's
sorry about
no
that.
big deal.
We're trying here.
That's all right. We'll plan for
background.
that. We'll plan for that next time. No issues. I don't want to keep the participants anymore. Everyone, thank you so much. Panelists, thank you so much for being there. Excellent presentation. I learned a lot as well. Luca and UNITAR team, thank you. All the best. Have a beautiful day.
Thanks, key speakers. Thanks, Paul. Thanks, Jimmy.
Thank
you. Thank you for hosting
Bye.
us. It's been wonderful. Thank you so much.
Thank you.